So good afternoon, everybody, and welcome to this special Kids in Schools edition of Vaccinate Nevada County, our weekly check-in with healthcare professionals, public health officials that will tell us where we're at in Nevada County and answer your questions. And normally to kick us off, we get a brief overview from our public health about where we're at in Nevada County. So Jill Blake, I think that would be your cue to tell us how we're doing.
Hi, Pascal. Thanks for having all of us here. I'll just try to sketch a local picture to prepare for this wonderful panel that you've put together. In Nevada County, our case count is declining, which is terrific news. And we expect this to be reflected in our numbers that the state posts next week. We, like nearly all counties in the state, have seen a slowdown in the uptake of vaccine. But we did see an uptick last week when the Pfizer vaccine was authorized for use with kids 12 to 15. At our Whispering Pines clinic, we had 70 walk-ins on Thursday, families and children cheering and excited to get vaccinated. And some of our vaccinators said it's sort of a first for them to see kids who actually want to get vaccinated. But they understand the implications of doing it. So yes, excited, and again, family cheers all around. And then on Friday, I think we had 101 first dose appointments as well. So again, seeing a slight uptick in that. But there's still work to do on both sides of the county and with all age groups, but in particular our younger people here in Nevada County, the 18 to 49. We're working to address the obstacles that exist for folks who want to get vaccinated or open to being vaccinated. We often refer to the vaccine as free, which it is, but I do want to recognize that there can often be costs for families, whether it's taking time off from work or looking for a babysitter or transportation. So we want to hear about what those obstacles are, and then we want to work with you all and the community to help overcome them. One such attempt that I want to just make a plug for real quick, if I may, and that is that working with the state, via the My Turn website and the toll-free number, people can now request in-home vaccinations for people who are homebound. And for people for whom transportation is an issue, the operators at My Turn will help arrange transit to a vaccination site. So we want to both meet people where they are if they can't come to us, and we want to get people to where they need to be if they're open to being vaccinated. So again, if you go to the My Turn website or you call the toll-free number, you can access both those services. And again, from the community, please don't hesitate to let us know what obstacles you might be facing, and we'll work to overcome those as well. So I'm super happy that you have this group of people here. The other thing that our department has been experiencing is lots of questions from parents and some young people, and you have a terrific panel here to address those. Thanks. Thank you, Jill. And yes, and thanks to Taylor and everybody at the county who helped put the panel together, because, no kids here. So it's like, oh, pediatricians, wait, how are we going to do that? So one of the things that I would like for all of you is to address some of the more general questions that we got. And let's start with the schools. We got a number of questions from parents who wanted to know if they could find out if their child's teachers had been vaccinated, if the kids are attending in-person instructions. So, and I am not a HIPAA specialist, but I think that giving somebody else's vaccination info, how are the school districts handling this?
Well, I guess I can start. Hi, I'm Sharyn Turner. I'm the coordinator of school health services. Our superintendent, Scott Lay, was not able to be here today, so hopefully I can answer questions. As far as HIPAA and confidentiality, we are not required to ask if they are vaccinated or not, but I can reassure everyone that approximately 80% of our teaching staff did go through a all 3-day clinic where the school nurses volunteered their time. It was held at Nevada Joint Union High School. And every teacher, staff, custodian, every employee was offered the opportunity to receive their vaccinations. And if we go by how many staff we have in Nevada County, which is about 1,451, I think is the last number within our Western County schools, approximately 80% of them received two doses of the vaccine. So we were very pleased with that. And additionally, we also had the opportunity, and with the collaboration of Western Sierra Medical Clinic, for those teachers that couldn't be vaccinated at that particular time, such as if they were in contact tracing or they had to be gone from the school facility at that time, we made a priority that they would be able to be called when we had extra doses at the end of the school day. And then we also prioritized our substitute teachers, which a lot of them are in the upper age group with a higher risk. And also any other contract person, such as someone that comes into the school periodically, was offered the opportunity to be vaccinated. So I think parents should be very confident that the majority of the teachers are definitely, and all staff, take this as a very important thing to be able to do for their kids.
And I'll just chime in from Eastern Placer County and Tahoe-Truckee Unified School District specifically. Thank you to this incredible partnership from Nevada County Public Health and Tahoe Forest Health System. All of our staff had the opportunity to get vaccinated back in February. And we are excited. Like Sharyn, we have a very high percentage. We actually have about 91% of all staff are vaccinated. For privacy reasons that Sharyn shared, we cannot disclose if someone, we can't even ask, oh, have you been vaccinated? But the good news is the large majority have, and any cases of COVID that we've seen since then have not been transmitted at school and have been 100% student transmission.
And I have to say, as a reporter, I went to the gymnasium at NU, and I saw the teachers. The vaccination clinic there over those 3 days, and there were a lot of very smiling faces and fist pumps when the teachers got vaccinated. That was really one of the first really good news stories that we had about COVID in Nevada County. So thanks everybody for organizing that. That was incredibly important. Now for the more kid-centric questions, generic questions. What kids that have underlying health conditions such as diabetes, are there any concerns for them to get the vaccine?
There are no contraindications for them.
I'll chime in. Yeah, it'd be even more important for them to get the vaccine than without those issues.
Michael, your connection is pretty bad. So maybe Polly, can you maybe repeat it and translate for us? And Michael, if you could maybe reconnect, because your video is freezing up and so is your audio.
I'll translate for him. So there are no contraindications for children with things like diabetes or most of those medical conditions. And in fact, they're at higher risk for complications from COVID, and so have a higher priority to be vaccinated. And of course, if you have any specific questions, talk to your pediatrician, myself, Michael, Joyce, or Dr. Harris.
Joyce or Michael, anything to add to that?
No, I just would reiterate, while the COVID rate of getting it, complications, hospitalizations are much lower in children, it is possible, to see children with hospitalization or severe disease, especially a multi-inflammatory situation, which is kind of like Kawasaki. and that the risk would be raised with any underlying conditions, asthma, diabetes, certainly, but a lot of other more rare neurologic problems too. So we would strongly encourage, children with those conditions for their parents to contact us if they have concerns or questions about the vaccine, and help, them get their questions answered, and, get them vaccinated if that's appropriate for their family.
Yeah. And just a reminder that, children do have a lower rate of complications, but there have been more than 200,000 children who have to be hospitalized for COVID in the United States. So that's a significant number of hospitalizations.
And kind of piggybacking on that, we have a question from Elise who's asking, what do we know about long-term symptoms for kids who contract COVID?
So kids who contract COVID, I'm sorry, if you guys want to talk, just raise your hands, but Mike knows, I'll always chat, but the long-term consequences are also there for kids who catch COVID. Mostly we're seeing cardiac and neurological long-term side effects. Those seem to be the two main ones. There was an interesting kind of case study out of Ohio State looking at their football team. So not quite teenagers, but young, late teens, early 20s. And they had a lot of mild and asymptomatic cases, and yet still 30% of that team had myocardial damage or heart damage after COVID. So we know even kids who have asymptomatic cases or mild cases are at risk for having long-term effects. We don't know yet if they get worse with time. We don't know kind of what the long-term case is for that, but you do have to be cleared for cardiac clearance to return to sports. If you've had significant symptoms of fever for more than 4 days, has to see a cardiologist before they can return to sports, or a pediatrician.
Yeah, I would second that. Some of the young adults I've seen in college mostly coming home, a handful of them have, had some chronic fatigue, chronic headaches, chronic, neurologic mental health issues too, after having had COVID, in completely healthy people. So I don't think we have a lot of concrete information to say what the percentage is or how many are likely to go on to have symptoms or no symptoms post-COVID. But I think, like adults, we're seeing that it's not as benign as a lot of other viruses. Even with full recovery, there can be some secondary problems later, which are unfortunate. So I try to put that in perspective for parents too, is that, having COVID may not be a terrible illness for your child, but it certainly comes with a little bit of risk for chronic conditions or things that may continue chronically. And as far as we know so far, the vaccine is extremely well tolerated. So from a personal standpoint, I would rather have the vaccine than the disease for sure, even with full recovery. And it appears that the immunity is also better with vaccine as opposed to with disease. So we know, now that we're a year plus out, what antibody levels do after infection. They go down 3 to 6 months later, and there's the potential for reinfection also. We don't have super long-term information, but as far as we can tell, the antibody levels are persisting better and longer and stronger with vaccination. So it appears that vaccination is going to provide a better immunity than natural infection.
On the educational level, I can also include that our protocols most likely are changing. The athletic associations are already coming up with specific protocols for students in athletics in the return to school. So just similar to our concussion issues.
And I think that's pretty important, because there's also we had a number of questions for where parents want to know if, and especially after June 15th, so for the coming school year, if there will be any changes to extracurricular activities, so sports, band, etc. Maybe if they both sides of the summit, if you can address that.
Sure. I'll jump in, and Jeff, please chime in as well. I would say that there's a lot still unknown. We're waiting on guidance, which we hear is coming out in the next couple of weeks from the California Department of Public Health. we're a little tricky here in Eastern Nevada County because we get out of school on June 18th, 3 days after things get lifted. What we have decided as a school district, because it's so close, the end date, is we are going to keep our mitigation measures in place for this school year till the end, including wearing masks, whether indoors or outdoors, and the current physical distancing. And then once we have the new guidance, we are looking, we believe it will change for the new school year, and we are going to wait for that guidance, and we'll probably know more in July. And we'll continue to keep parents updated. And we have a website that has all of our latest COVID resources, and everything's there right on the homepage of that.
I can add to that. Thanks, Kelly. Jeff Santos, Executive Director, Student Services for Tyler Truckee Unified. Since about 6 weeks or so ago, we actually came back 5 days a week with our students with amazing mitigation measures in place. And as Kelly alluded to, we've managed to keep any transmission in our schools out. We are on a reduced schedule 5 days a week, but our plan is to still move forward next year with a pre-COVID type schedule of more of a full day, 5 days a week, with our mitigation measures in place as well. And kind of what Kelly said, just monitoring throughout summer, any and all changes that public health pushes out that we might need to be mindful of as well.
And Sharyn, yep.
I can say the same is in Western Nevada County Schools. Scott Lay, our superintendent, is in close communication with all the school districts, including our charter schools, and even our private schools participate in the protocols. And meeting every other week. We're waiting for guidance from the state. It seems like every Friday afternoon we get new information, but everyone is in huge anticipation that we're going to go back to school 5 days a week at the beginning of the next school year. So we're feeling very positive.
Great. Here's a question. Right now, only the Pfizer vaccine has been approved for use in younger kids. Some parents want to know if Johnson & Johnson will be approved because of the convenience of the one-shot dose, and what's your take on that?
So Johnson & Johnson, I think, has not even started their trials for children yet. So it may be approved, but that's going to be farther out. Moderna is a few weeks behind Pfizer, so we're expecting to hear news for their study for teens coming at any time. But Johnson & Johnson is going to be months behind that. I don't think it will be anytime soon.
And then as a follow-up to that, are there any, if any, either, so the question was if either Moderna or Johnson & Johnson were approved, is there anything that pediatricians would recommend one over the other? So is there any, what is your preferred vaccine for kids?
The first available, which is Pfizer.
There's always the issue of having them come back for a second dose. But we are just telling people whatever they can get and get it.
Don't wait for the single dose. It's going to be, if it's available when you're ready, then that's great. But in the meantime, I would be getting the one that's available right now. That's the one that would be preferred.
And efficacy between Moderna and Pfizer is so similar that statistically there's really no difference.
They're essentially the same, and the ingredients are almost essentially the same. They're very similar vaccines.
Right. And then just in looking ahead to like what's happening with variants, they both are so similar in terms of covering variants pretty well that one wouldn't be preferable over the other in terms of variant coverage.
And a practical questions, if kids get their first dose and then summer break happens, parents travel, are there any concerns that if kids cannot get the second dose as scheduled with their pediatrician, is there any chance that they can simply go to wherever their vacation destination is and get the second dose? What are the practicalities of that? Do parents need to have an immunization record with them? Can you tell us how would that do? And also, if people are coming to Nevada County and they want a second dose, what are the mechanics of that?
I think there's enough supply everywhere that as long as you can get an appointment, you're fine to get that second dose wherever you can. You would need your vaccine record so it could be recorded and you could bring it back to your primary pediatrician's office so they know. Also, the studies in the countries who are doing a prolonged schedule where they're waiting 3 months between doses, the efficacy looks just as good in those studies as they are right now in the US with our 3-week schedule for Pfizer. So if you waited till you came home from vacation, that would probably be fine as well, either one of those plans.
And of course, the parents can always consult with you and see what the best options are with, or what they're most comfortable with, I would assume.
Mm-hmm.
And speaking of being comfortable, what about, so are there options available for parents who are divorced and who disagree on vaccine or not? So what do you do? And yes, and you're not King Solomon, so something's got to give. So what's your advice?
Yeah, I mean, this is not a new issue. So, living in Nevada County as one of the most unvaccinated counties in California, we encounter this problem a lot. So just with normal routine childhood immunizations. So my advice is always for parents to talk, independently without the child. So there's not extra, emotional burden on the child, and to really try and understand each other and talk openly about it. They're always welcome to come and talk to us in the office or by phone to have the other parent, get their questions answered or their fears allayed if need be. But legally, a parent who is a guardian can come in and have a vaccine done unless there is a court order from the other parent. So that's where the legality sits. However, that creates for very bad parental relations. So I always encourage them, not to do that behind their other parent's back, but to come to some kind of agreement. And if it needs to be, with a mediator, sometimes that's what has to happen.
And that what we do in the schools too, and this has happened to me many times, that the student will come to the school nurse or talk to someone at school about the frustration of one parent not wanting them to be vaccinated. And for example, just the education of the student, such as, well, what are your goals in the future? If you want to go into health services or you want to be in law enforcement, many times it depends not just on COVID vaccines, but other vaccines as they go through their developmental stages. I have seen it work that once the child knows how it's important and that they prefer, they can sometimes mediate between the two parents and make that decision that is compatible with both of their feelings about it. Otherwise, they have to wait until they're 18 to then decide if they want to get vaccinated or not.
But I think it is important to involve the child always, even if the parents, even if it's not that type of a situation, because currently the vaccine, we're giving it to 18 and over, and then through the county 12 and over, and those kids are certainly entitled to, the conversation about why it's being given and risks and benefits and all that. So, and I think sometimes putting the child first, in my experience, sometimes the parents do come together a little better, if you're lucky.
It's never easy. It seems easy. It's surprising too. But another question is, will any of the school districts require kids to be vaccinated? And if so, will you also require teachers and support staff, but in other words, mandatory vaccinations to attend school?
I don't ever see that happening within Nevada County schools. We have students that aren't vaccinated that have medical waivers for other vaccinations. And Dr. Joyce is right that we're not just one of the counties with the highest number of waivers. We are number one county.
I believe we actually retrograded to being number 2. I believe.
Oh, did we just go down? Well, that's
I believe Jill would probably know better, but I think we're now the second worst, or the second from the bottom as far as immunizations go.
You are correct, Pascal.
Yay.
On the Tahoe, go ahead, sorry. Oh, I was going to say on the Tahoe Truckee Unified District side, same with Sharyn, we're not going to be requiring that of any of our youth or our staff. And like Kelly alluded to, 90+% of our staff have received the vaccine. Obviously, we follow public health and whatever the rules and recommendations and guidance is. So if it comes down at some point that it falls in line with other immunization requirements, of course, we would follow that. But at this time, we're not.
And just to chime in to add to what Jeff said is that what we will do now that the vaccine is much more widely available and for 12 and above, we will communicate it out to our parents regularly in our newsletters and just encourage, just like we did with staff, encourage people to get the vaccine, get vaccinated, focus on the benefits, and communicate the information so that it's easy for people to know where to go, where they can get it. So that would be kind of the approach we're taking, and just really advocating to encourage.
One additional piece on the school front for us, we will be working with families on identifying those students who have had received the vaccine and put it in their confidential health file. And the reason for that is if there is a student or a case where there's a positive case on campus, when we do our contact tracing, we're trying to determine if they've had the vaccine and if they're considered a close contact or not. So we'll be working with families during the summer on that.
Yeah, I would stress, just from a practical day-to-day personal experience also, my children are both in high school. One is fully vaccinated, the other is half vaccinated now because she's 15. However, we've had, even though they've been going to school pretty much the whole year in Colfax this year, we've had several times where they had to quarantine at home because they had an exposure at school. And this was when they were 6 feet apart, fully masked with dividers around their desks. And this is only, if COVID, does make a little bit of a resurgence or hangs out still next year, we're going to be in the same situation and potentially unmasked too. So the burden for, each individual child to have to quarantine, for the school to have to provide, that digital service to the kids who are quarantining for 2 weeks, the loss of their function of their life, not doing athletic activities, a different quality of education, having to be home and isolated from their peers again is, going to continue this devastation that youth have seen with this pandemic, is that their education and their social lives are going to be uninterrupted. I think this is one of our best shots, even though this disease is not as serious in this age group as older individuals, to help our youth return to normal life, keep their education and their social life uninterrupted.
And I just want to clarify for those listening in case they didn't catch it. The benefit to being vaccinated is if you have a close contact, then the school guidelines are now, unless you're having symptoms, you do not have to be quarantined. So if you're on that football team and there's a case of COVID in the football team and you're vaccinated, you still get to play football as long as you're not having symptoms. If you're not vaccinated, you're out in quarantine for 2 weeks. So there is a benefit really to getting back to regular life, like Dr. Joyce talked about.
And let's face it, there's also benefits for parents. If the kids can go to school, because I believe what our parents discovered was that school, the teachers and the whole system, they do a pretty amazing job, because a lot of parents are realize that they will never ever vote against any school bonds that are coming up, just to make sure that the kids can remain in school. So that's one of the positive outcomes, hopefully. We are on our half-hour mark, so first I would like to thank all of you for being here. And before we go, I would also like everybody to what do you want to tell parents, and what do you want to tell the kids? So if each of you, if you can, we call it the parting shots of wisdom.
I'm in the nursery, yes. It looks like it might be doing something.
I just want to say that the vaccines are easily available. You can make appointments now through My Turn for either Docomo's or the county. And then there'll be the school and Western Sierra Medical Clinic, and hopefully Sierra Care will be involved with us, are sponsoring a vaccine clinic on June 5th for all school-age children or 12 and older and their family members. So June 5th is a Saturday. There's lots of vaccine available. And then also we have a walk-in clinic at Western Sierra today for Johnson & Johnson for any adult family members who want that Johnson & Johnson. There's plenty of vaccine and walk-ins available this weekend on 9 to 2.
Copies to go.
And just for the ones that don't know, where is the clinic?
844 Old Tunnel Road, right in Brunswick Basin behind Safeway.
Thank you.
And I would just say the vaccines are safe. They do help you get your life back out in the open, and they do not cause problems like infertility. We get a lot of questions about that. So there's not really a downside.
My kids both got them last week.
On the school end, I'll add and say we definitely have been excited seeing our students back in person. There's nothing more that brings smiles to our faces than seeing them. And so encouraging parents to not let their guards down, in the sense of we do see a lot of transmission at sleepovers, parties, where not following through. So just a reminder, in order for us to continue having our doors open and students in seats, including next year, unless they've been fully vaccinated, we ask that they just continue to be mindful of that, because it does impact, as you've heard today, innocent students that are following the rules, but and/or around that, and have to quarantine and miss out on things. So thanks.
Yeah,
Jeff took the words right out of my mouth. Sorry, Dr. Joyce, go ahead.
No, finish.
Okay, he took the words right out of my mouth. And what he and I have said, along with our colleagues, is it takes a village. It takes a community. We need everyone to continue to be safe. I know it's sounding trite now, but like not letting our guard down is we've got to. It takes all of us doing it the right thing. But the best place for our kids is to be in school, on campus, emotionally, educationally, and we want that's our number one priority. And we need everybody's help to make that possible and keep that.
And I would just like to, really commend parents and students, about being patient with all of this. I know it's been difficult, to have their kids in and out of school. I commend them for, not blaming the schools or, demonizing the schools, or the medical system where they, are trying and are frustrated with the amount of testing that kids have to do, sitting out when they're symptomatic or they've been exposed. I mean, I think really everybody I've seen, while being frustrated, has been very understanding and really working towards the common good to help make this, as least impact on children as we can, and help really, provide for their mental health and their physical health too. So I just want to, commend all the parents and students that I've seen that have had an immense level of patience, with all of this, having to go this for the first time, and the frustration levels that they've had. I'd like to acknowledge that.
I could add also how lucky we are to live in the community of Nevada County, because a lot of work that gets done at the state level, we have been above the curve in the collaboration between our public health department, our clinic facilities and our Sierra Nevada Dignity Health Hospital. People have stepped up to the plate to make everything work. Early on, we were so fortunate to be able, even though it seems like we've been out of service for the entire year, every school district has tried either hybrid models going way beyond the curve, working with our special education department. The kids have been so resilient, and I know a lot. I'm surprised that the subject hasn't come up about get those masks off of my kids. But I can assure you that their sacrifice has been very, very well appreciated. And I'm amazed, even if you walk through the halls of the high school, how compliant even adolescents are. It's not that big of a deal to them, especially when they understand the importance of it in helping their grandparents or whatever. Masks are going to come off. Trust me, it will happen, but we just have to remain a little bit more patient. And we're going to finish the year with all feeling good that we've done a job well done. So thank you, parents, for putting up with some of those little nuances and contact tracing and all those phone calls, all those all calls that come in that we dread. It's all going to be behind us. Next year, we won't think of it as painful as maybe as we went through it.
Okay, Jill, what are the words of wisdom from public health?
I think I would just say that we want parents and young people to be able to make informed decisions about getting vaccinated. And so please continue to ask questions and get information so that you can do that. Ask of us, ask of anybody on this panel or any other resource you have. And if you've had the information and you've made that decision and you still are facing obstacles in terms of accessing the vaccine for any reason, please don't hesitate to reach out to the public health department and we will work with you to overcome that obstacle. We want to make sure that we can, again, either meet you where you are or get you where you need to be so that you can get vaccinated against COVID-19.
All right, with that, I would like to thank all of you for taking time out of your incredibly busy days. I know that you're all incredibly busy, so thanks for being there. And there will probably be a couple more questions that are coming in. So maybe we'll do a repeat closer to when school's about depending on the number of questions, either when it's supposed to stop or the beginning of before the next school year. Meanwhile, for those of you that want a little local color, it is hailing outside. So everybody at least in Western Nevada County, I have to say, but it's hailing out here. So be careful, still wear your mask, get vaccinated if you can, keep your distance, wash your hands, all that good stuff. And thanks again, everybody. And we will see you next Thursday again for the regular update of the Nevada County Vaccine Update. Bye, everybody.